Nola Pikacha, and I'm a fourth-year Master's in Ophthalmology student at the Pacific Eye Institute. Being blind in the Pacific is a burden on the family, and having blindness that is avoidable or treatable is an area which is not very recognized in the Pacific. But it's an area that we recognize and trying to raise the profile that you don't have to be blind because there is treatment for it. It's exciting going back now after all this training and to know that you're going back to a clinic that has had trained nurses as well now. So it's going to be interesting, and I'm really excited to see how we can further improve on what we have. Sometimes you get sucked in with the system that doesn't have much, to work on or work by, but just keeping the standards up to where it can get, even with the limited resources that we have currently. That's going to be exciting. I've never had a setback being female and working in the islands. Okay, my mother was a medical officer herself. She was the first female doctor of the Solomon Islands, and for her it would have been a challenge, but she'd always instilled with me that sure, being a female didn't stop you doing anything that you wanted to. So I guess I owe it to her that I don't feel I feel that I have a lot to offer back to the Solomon Islands. If it would be something that females could, younger girls or those who are my juniors in medicine and planning on doing further studies, and if I could be that role model for them, then that'd be something I'd be very proud to be. It's the places that we go that have a lot of people, where the backlog is a lot, and we know we're in for long days. It is a challenge when you're going to an area for the first time. You don't know the population, you don't know the setting of the hospital, and that's a bit daunting initially. But now that I've basically been back and forth to most of the places, every year I see it improve, and it's like, yes, I know how to handle this now, and every situation is different. When you go on outreach, you do a higher volume of surgery than you do here. So you get a hang of, if you had complications, of how to deal with that. And I think that has been one of the greatest advantages of doing this, is that you get the surgical experience, you get the feel of dealing with complications that makes you competent of working on your own. The moment you take the patch off afterwards, people react differently, but you know that they're very grateful when the patch comes off, and they smile and they look around, and sometimes I don't speak to them, but I put my hand out and they just reach out and shake my hand, and I know you see it on their face just how grateful they are. And I guess there's just nothing that pays so much as a patient being grateful for recovering their eyesight. The Fred Hollows Foundation drives their mission with providing eye care to all the Pacific. Yes, we've sort of taken on that and made it our own mission now, that providing eye care to everyone, not just those in our towns, but those ones who are out in the districts, right out in the periphery, that we also can offer quality eye care to them as well.